What is premorbid intelligence in schizophrenia? Imagine trying to understand a person's mind before they face a serious illness. That's what premorbid intelligence is all about. It looks at how smart someone was before they developed schizophrenia. The word premorbid means before illness, and intelligence is usually measured by tests called IQ or intelligence quotient tests. These tests give a number that shows how well someone thinks, learns, and solves problems. Knowing this helps doctors see how much a person's thinking skills have changed over time. To figure out premorbid intelligence, experts often use special tests that measure skills less affected by schizophrenia. For example, reading ability or general knowledge tend to stay stable, even if other parts of thinking decline. One common test used is the Wechsler Adult Intelligence Scale. It has parts like vocabulary questions that can give clues about a person's premorbid IQ. These parts are called hold tests because they tend to stay steady despite the illness. Research shows that people with schizophrenia are very different when it comes to their premorbid intelligence. Some studies suggest that on average, they might have slightly lower premorbid IQ scores than the general population. But this isn't true for everyone. Some people who develop schizophrenia had normal or even high intelligence before their illness started. The link between premorbid IQ and schizophrenia depends a lot on how the illness is diagnosed. Different diagnostic systems sometimes find different results. It's also important to know that not all people with schizophrenia experience a big drop in their thinking skills. About 30% of them keep their premorbid IQ levels after their symptoms begin. But around 70% show some decline. A drop of 10 points or more on the IQ test is usually seen as a significant decrease. People can be grouped into 3 categories: those whose intelligence stays the same, those with lower but stable IQ, and those with clear decline. Cognitive changes in schizophrenia tend to affect certain skills more than others. For example, crystallized intelligence, like vocabulary and general knowledge, usually stays stable. But fluid intelligence, which involves solving new problems and thinking abstractly, often gets worse. Skills like working memory and how fast someone processes information are also often impacted. Understanding premorbid intelligence is helpful for clinicians. It helps them figure out which patients might benefit from specific treatments like cognitive training or social support. Recognizing that each person's cognitive profile is different also helps challenge the idea that everyone with schizophrenia has the same level of intelligence. It shows how varied the experience can be and why personalized care is so important. In short, premorbid intelligence is a way to look at how smart someone was before they got sick. It's measured with tests, and not everyone with schizophrenia has a lower premorbid IQ. Many maintain their abilities, and the amount of change after illness varies widely. Knowing this helps us understand the diversity of experiences among people with schizophrenia and guides better support and treatment options.